Less than a dozen coronavirus cases have been recorded in Victoria in the past 24 hours. Reporter Stephanie Ferrier joins us now live from Melbourne. Morning, Steph. Take us through today's figures.
Good morning, Lorna. We have 10 new cases of coronavirus detected since yesterday, and that is of course double the figure that we had yesterday, just 5 new cases, and that was the lowest since June the 12th. So while this is an uptick, it will be very interesting to see off the back of what testing numbers they come from, because yesterday's figures came from just 6,800 tests. Now, more importantly, it does take our all-important 14-day rolling average in metropolitan Melbourne below the 20 mark. It's now sitting at 18.2, and of course remembering that we need to get under 5 new cases. That number needs to be under 5 in order for us to move to the next step in relaxing restrictions, and the big one of being able to get out of lockdown, with some of these people being able to return to work as well. So that's scheduled for October the 19th, and hopefully we can make it by then. Sadly, there have been 7 new deaths also recorded. That takes our toll from coronavirus in Victoria up to 794. The 14-day rolling average for regional Victoria, I should add, is just remaining steady at 0.6, but of course they already are in that third step out of restrictions.
Final submissions to the hotel quarantine inquiry have been given. What did they say? What did they find?
Yes, so this was the lawyers assisting this inquiry, wrapping up the hearings yesterday with final submissions, and of course it's now in the hands of the former judge Jennifer Coate, and she's expected to hand down her final report in just over 5 weeks' time. But what we did hear from those lawyers was that they say that the failures in this hotel quarantine program were responsible for some 768 deaths and counting, and more than 18,000 infections in Victoria's deadly second wave, triggering, of course, widespread devastation and despair. They say far from containing this virus, it actually became a seeding ground for spreading COVID-19 into the general community. So just who is responsible for all of this? Well, they could not point the finger at any one particular person or one decision. However, they do say that there was clearly inadequate infection control procedures at the hotels, and it appeared as if this program was more focused on the logistics rather than those health concerns. We also heard that they say that it was astonishing that not one single senior government official could actually say who made that call to use private security guards. And Council Assisting Rachel Elyard said it appears as if the decision by Victoria Police and their clear reluctance to guard these hotels led to a creeping assumption among government officials that then led to this decision, although there was nobody that actually questioned that decision. There's also been, of course, a lot of finger pointing between senior bureaucrats and government ministers as to actually who was in charge of this program. She concluded that it was the Department of Health and Human Services in charge of this botched program. Now, we've already seen the resignation of the Health Minister, Jenny Mikakos, and Daniel Andrews has repeatedly said that he will not comment on all of these matters until he receives the report findings.
Stephanie Ferrier, thank you.